So now I'm going to do my skills portion of my injectables checkoff. I do already have a verified MAR. This MAR was verified by Caitlin Ryan. Before I get started, I'm going to perform hand hygiene. All right, so I am starting at the Pyxis. According to my verified MAR, my patient's name is Manny Stickens. Date of birth is 12/15/48. MRN number is 000734421. He is a 64-year-old male, and it looks like he is allergic to penicillin. So I will be administering his 0900 medications today, as well as a Practitub PPD skin test that is ordered intradermally now. All right, so I am at the Pyxis. The first thing I'll be taking out of the Pyxis is the demo dose of 0.8 mLs. So here I have a 2 ml demo dose ampule. So that is more than enough. Expiration date is 2/20/29. All right, next I have the insulin R of 7 units. I have a 100 unit insulin R right here. Expiration date is 2/20/29, so we have more than enough and it's all good to use. Next, we have an insulin N of 14 units. We have an insulin N right here of 100 units, so there's more than enough. Expiration date is 2/20/29. All right, and lastly, we have a Practitub PPD of 0.1 mLs. We have a Practitub 1 ml bottle right here. Expiration date is 2/20/29. So we have more than enough and it's all good to use. Now that we perform our first medication verification check, we are now going to go over to the nurse's station. All right, so before I get started at the nurse's station, I'm going to perform some hand hygiene. And I will be putting on some clean gloves because we are going to be measuring out medications. All right, so first I'm going to perform my second medication verification check. My first one is the demo dose of 0.8 ml. I have a 2 ml ampule right here, so I have more than enough, and expiration date is 2/20/29. Next is we have an insulin R of 7 units. I have a 100 unit insulin R bottle, so we have more than enough. Expiration date is 2/20/29. Next, we have an insulin N for 14 units. I have a 100 unit insulin N bottle. We have more than enough. Expiration date is 2/20/29. And lastly, we have a Practitub PPD for 0.1. I have a 1 ml Practitub PPD bottle right here. We have more than enough. Expiration date is 2/20/29. Okay, so now that we performed our second verification check, we are going to now draw out our medications. So the first one is our demi-dose. The first things we need for a demi-dose is a filter straw. We will need a 30 ml syringe. Let me show you the filter straw. And then we're also going to need a 22 gauge 1 1/2 inch needle. And then I also like to get a measuring cup and an alcohol swab. So what we're gonna do is we're going to open up the alcohol swab because I like to use it to open the ampule. First, I'm going to flick the ampule to make sure all of the medication is at the bottom. Now that it is, I'm going to open it away from me, just like this. I'm going to discard that into the sharps container. Next, I will be taking my syringe, and I'm going to be connecting it to my filter straw. Now, I'm going to be careful not to touch the sides of the ampule, but I'm going to be withdrawing all of the medications into my syringe. And then I'll be measuring out the excess later. Okay. All right, so I'm just gonna flick for the bubbles. I'm going to unattach that and throw the filter straw into the sharps container. I'm going to connect my syringe to my needle. All right, I'm just gonna push this up a little bit. All right, so now I am going to measure out 0.8 mLs into my measuring cup, or I'm going to be throwing the excess into the measuring cup. So I'll be measuring out 0.8 mLs. Now I'll be flickering for the bubbles. Alrighty, I have 0.8 mLs of Demodose. I am going to be recapping this properly and safely. Alright, so now I'm going to make my label using the triangle method. Alright, so I'm going to write Demodose. Dosage is 0.8 mLs. We're going to be giving that intramuscularly. Expiration date 2/2029. I'm going to be wrapping this around my syringe, being careful not to cover the plunger. All right, here is my label. Demodose 0.8 mLs, 2/2029 is the expiration date. Let me set that aside. I'm gonna throw this into the sharps container. All right, next I am going to be measuring out my insulins. I'm going to be rolling up the insulin bottles first. Next, I will be taking 2 alcohol swabs and I will be cleaning the tops of the bottles for 30 seconds each. All right, it's been 30 seconds. And it's been 30 seconds. Okay, so now that we've gotten that ready, for this one we are going to be using an insulin syringe. It's 29 gauge 1/2 inch needle. All right, so first I am going to, now that it's all prepped and it's all clean, I'm going to uncap, and then I'm going to first pull out 7 units of air, and then I'm going to pull out 14 units of air, so I'm just going to bring the plunger all the way down to 21 units. All right, 21 units. So now I'm going to go into my insulin N and I'm going to inject 14 units of air. All right, and then I'm going to be injecting the rest into insulin R. Now I'm going to invert insulin R and I'm going to measure out 7 units of insulin R. And now I'm going to insert, and then I'm going to invert insulin N. And I'm gonna pull out 14 units. I'm just gonna bring the plunger all the way down to 21. Alrighty. Okay, so I do have 21 units of insulin, so I have 7 units of insulin R and 14 units of insulin N. Okay, so now I'm going to recap this safely. Just like that. All right, so now I'm going to create my label using the triangle method. I will walk this over, wait, no, just not yet. I'm going to create the label first before I walk it over to the Pyxis. All right, so I'm going to write insulin R, and insulin N. Insulin R has 7 units. Insulin N has 14 units, and they both expire 2029. I'm gonna wrap this around my syringe. Being careful not to cover the plunger. So here is my label, insulin R and insulin N, 7 units of insulin R, 14 units of insulin N, and they both expire 2029. I'll put that aside for now. Now I can walk this over to the Pyxis because it is a multi-use bottle. Lastly, I'm going to measure out PractiTub PPD. So first I'm going to clean the top of the bottle for 30 seconds. Alrighty, it's been 30 seconds. Now I'm going to use a 1 ml syringe. It's a 27 gauge 1/2 inch needle. And what I'm going to do, so I'm going to uncap it, and now that it's all clean, I'm going to pull 0.1 ml of air, and then I'm going to inject 0.1 ml of air into my PPD. I'm going to inject it. I'm going to invert the bottle, and then I'm going to pull out 0.1 ml of air. All right. I'm going to flip for some bubbles. Okay, here is 0.1 ml of the PractiTub PPD. I'm going to safely cap it. And I'm going to make a label for it. All right, so I'm gonna write PractiTub PPD. Dose is 0.1 ml, and intradermally, expiration date 2/2029. Alright, wrap it around the syringe again, being careful not to cover the plunger. Alright, so here's my label, PractiTub PPD 0.1 ml intradermally, 2/2029 is the expiration date. Alright, so I am going to walk this over back to the Pyxis because it is a multi-use bottle. I'm going to remove my gloves, and I'm going to be performing hand hygiene. Alright, now that we've measured all of our medications, we will be heading to the patient's room. I will take new clean gloves. These are new clean gloves. And I will take some alcohol swabs and some gauze. We are now at the patient's bedside. Before I get started, I'm just gonna perform hand hygiene really quick. And now I will be putting on my new clean gloves. Knock, knock. Hi, my name is Yasmin. I'm going to be administering your 9 a.m. medications today, as well as a PractiTub TB skin test. First, I'm going to verify your name and your date of birth. Let's see right here. I'm going to take your armband, and I'm going to put it directly on my MAR, and I'm going to compare it. I see your name is Manny Stickens. Date of birth is 12/15XX. Age 64, MRN 000734421. And I see you have an allergy band. Are you allergic to anything? Penicillin? And what kind of reactions do you get? Hives? Okay. All right, thank you for letting me know. So now that I've verified his name and date of birth and his allergies, I am going to perform my third medication verification check at bedside. So I have my demo dose of 0.8 mLs. Here's my demo dose, 0.8 mLs, expiration date 2/2029. And then I have my insulin. I have insulin R and insulin N. Insulin R has 7 units, insulin N has 14 units, expiration date 2/2029. And then I have my Pratita PPD. Here is my Pratita PPD, 0.1 mLs, expiration date 2/2029. All right, so now that I've verified that, I've verified the patient's name, we're all good to go. So for the demo dose, I will be inserting this on your right arm, on your right deltoid muscle. So the way to find your deltoid is I will find your shoulder first. I'm gonna find your acromion process, which is right here. I'll put 3 fingers below that acromion process. So the injection site will be right here below the fingers. So I'm going to just clean that site real quick. And because I am going intramuscularly, I will be going at a 90-degree angle. I will use the Z-Track method. And then I will also make sure to aspirate. So I will let that dry for 30 seconds. So I will take my demo dose. And so we will be administering this on the right arm, on the right deltoid. So I'll be using the Z-Track method to pull the skin firm. I will go right here. This is my site of injection. I will go at a 90-degree angle because it's an IM injection. I will insert the needle. I will aspirate. And then I will insert all of the medications. Perfect. I will pull and then I will throw that into the Sharps container. All right, next is your insulin. I will be administering the insulin on your left lower abdomen, 2 inches away from the umbilicus. So here is your left lower abdomen, 2 inches away from the umbilicus. I'm going to test the site. It looks like I can squeeze more than 1 inch of subcutaneous tissue, so I will be inserting the needle at a 90-degree angle. So let me just clean the site first and just making sure we are 2 inches away from the umbilicus for safety reasons. I'm just going to clean the site for 30 seconds. All right, it's been 30 seconds. I'm just going to wait for that to dry. All right, so now that it's dry, I'm going to uncap my needle. We are going to go to 90-degree angle. So what I'm going to do now is I'm going to take your subcutaneous tissue in your left lower abdomen. I'm going to squeeze it. I'm going to inject at a 90-degree angle. I'm going to release the skin. And I'm going to insert the medication. And then I'm going to slowly take out this. All right, so I'm going to apply gentle pressure. And then just make sure, you will see some redness and some pain, or you might feel some soreness and some redness, but try not to itch it and just try not to irritate it too much. Just let it be. And then can I see your deltoid muscle real quick? I'm just gonna apply gentle pressure real quick. And then you will feel some soreness as well on your deltoid muscle, but try not to itch it, try not to irritate too much, but just know you will feel some soreness. Okay. All right, so now that we've done that, lastly, we are going to do the Pratita PPD on your left arm, on your ventral surface of your left arm. So it's going to be right here, and what we're going to do is we're going to inject the medication in at a 5 to 15-degree angle. So let me see your left arm. I'm going to clean the site. All right, I'm going to let it dry. All right, so I'm going to go at a 5 to 15-degree angle. I'm going to pull the skin taut. I'm going to make sure that my bevel is up. I'm going to insert my needle in, 5 to 15-degree angle. I'm going to insert an 1/8 in. just to make sure that the bevel is covered. And then now that the bevel is covered, I'm going to insert the medication until I see a wheal or a bleb. And I do see a wheal or a bleb. I'm going to gently pull out my needle. And I'm going to throw into the sharps container. And I will not put pressure on this. And you might feel some itchiness and you will see some swelling. However, just don't touch it, don't irritate it, don't itch it. And you'll make sure to have your results read in 48 to 72 hours by a nurse. But yeah, just try not to irritate it for the next few days, okay? If you have any questions, just let me know. Now that I have administered all of my medications, I'm going to perform my safety checks. I will give back the call light. I'll lower the bed and make sure that the patient is safe. I'll remove my gloves. I will wash my hands and perform hand hygiene. All right, I will exit the patient's room now, and I will go over to the nurse's station, and then I will cross out the time for demo dose, initial my name. I gave the demo dose on the right arm. The insulins, I will cross out as well. I gave that on the left lower abdomen. The Prati-Tub I gave at 0900 as well. And then I gave that on the left arm. And then I'm going to sign my name. And then I'm going to write my initials, and then I'm all finished.